You were named chair of the Department of Neurosurgery, and you're the only woman in the country to head up an academic department. Did you see the glass ceiling when you broke through it, or was it just another step for you?
If you ask me the question, which is more difficult, being a person with a disability in neurosurgery or being a woman in neurosurgery, I would have to say, honestly, I think it's being a woman in neurosurgery, because I think sometimes it's a little bit isolating, and women are different than men in the way they approach problems and the way they live their lives. It matters that I'm a woman. It matters that I'm handicapped. It matters that I've experienced, in my own life what it's like to be a patient. And I need to keep all of those aspects of my background in focus. I've always been very interested in the complexity of treating the developing brain. Much of the therapies that we use to treat tumors are directed at growing cells. And so it becomes very complicated to not hurt the child and at the same time kill the tumor, and particularly when you're talking about a precious organ like the brain. So I spent a lot of my time working on very targeted and directed types of therapy for pediatric brain tumors. When I first started training, there were tumors in which the survival rate was, at 5 years, less than 20%. And now, within the short lifespan, we've seen kids now with 85, 90% survival. So we've made enormous progress. That's what's exciting about working at the University of Michigan. There's always something new and novel coming down the pike, and you have a great opportunity to be able to apply it to patients, both pediatric patients and adult patients, because neurosurgical diseases and neurologic disorders can be devastating because they get you where you live. They get you with your ability to think, your ability to talk, your ability to walk, the things that we consider really important to the whole human being.
When you started, do you think you were prepared for the challenges that would come along with becoming a physician?
I don't think anyone is ever prepared for the challenges of anything in their life. And so for me, it was extremely important that I had tested myself adequately before I ever started the residency. And I did that by spending weekends and evenings with the neurosurgeons, literally walking in their footsteps. I wanted to make certain that I had the stamina, the intellectual ability, the drive to do this. Operations in neurosurgery are often quite long. They can be 12, 14, 16, 18 hours for some of the more complicated cases. It takes a certain amount of physical stamina and also mental and emotional stamina to deal with the problems that we deal with in neurosurgery.
You're doing a lot of work here at the University of Michigan, but you're also taking your work abroad, and you've done some work in Guatemala. Tell us a little bit about that.
Back in 1997, Healing the Children approached us here at the University of Michigan, talking to several physicians and asking if it would be possible for us to do a medical mission focused on neurosurgery for Guatemala. Neurosurgery is not the sort of thing that can be done without lights, without running water, on a dirt floor. It really requires a certain level of just infrastructure to be able to do it. And many of us have always been interested in third world medicine. It doesn't lend itself usually easily to something like neurosurgical procedures. But working with Healing the Children, working with the Pediatric Foundation of Guatemala, we began a project which we've now done for 12 years of going down to Guatemala for a week and doing neurosurgical procedures. We've done now a little over 350 operations. Every single person that goes down there comes away from it going back to the roots of why they became a physician, which is to take care of people.
Does your disability, do you think it gives you a special relationship with the parents and the children?
I think it does. I think that patients, and particularly parents, see hope, see possibilities, and ask themselves different questions because they've met someone who has a disability and is their physician, and perhaps think for their own children new possibilities. It's amazing to me that on a given day, I can walk into a room, introduce myself to a family that's never met me, and they will give me the most precious thing that they have in their lives, their children.
So you chair the department here. You have responsibilities outside of the University of Michigan, and you have a family.
I am married. I got married in 1997, and we adopted 2 children in 2004, and it's the best part of my life. Go with your hands up and down. Oh, see? You got it. You got it.
Did becoming a mother change you as a physician at all?
I think that it's impossible that it doesn't. Every child that I see that is the same age as my children, that looks like my children, I feel empathy for. I think I've always felt empathy for patients, but I think that when you see particularly the really complicated and sometimes cruel diseases that can affect children, you have just even more of a sense of the loss that a mom must feel, you know, at the death of one of their children, either from trauma or from cancer. One of my nurses was saying, well, what was the hardest thing that you remember with a family? And it was a young child that had a malignant brain tumor. And we had operated on the child, and the child had done actually very well. Was getting treated with chemo and radiation when the tumor came back. And the tumor came back with a vengeance and actually caused a large clot in the head, and the child was dying. And we, took the child to the operating room, operated on the child. It was very obvious that the tumor had actually invaded some of the blood vessels within the brain, and that there was no way that we were going to be able to save this child. I talked to the mom while I was in the operating room. We sort of agreed on a plan on what we were going to do. She wanted the family to be able to come to be able to say goodbye. So we finished the operation, stabilized the child enough to take the child up to the ICU. And eventually the family gathered. We took the child off the ventilator, and the child died. And there's that beautiful sculpture in the Vatican, of the Madonna with the Christ in her hands. And there I am up in the ICU. The mom is holding this child with this pristine little head dressing on, and the family's there. And the mother said to me, and I will always marvel at this, she said, I will cry, I will be upset. She says, and somehow, because of my other children, my family, my husband, I'll get beyond this. She said, but I want you to know that our entire family is praying for you, because you will do this not just today, but you'll do this again and again and again. And I have to say, to see that much kindness, to see that much humanity in someone who is going through her own tragedy really just overwhelmed me. I think if I thought about all the parts and the pieces and the complexity of getting from where I was to where I am, I might have been frightened of all of it. But like most people, it's one step after another. I don't think I ever thought I'd be a chair of a department. I'm not sure that I ever thought I'd be married with kids. I am very fortunate, and I recognize that. And though chance may favor the prepared mind, I also recognize that people have given me opportunities, and therefore it's my obligation to make certain I give others opportunities, and that I see all the possibilities, not just the impossibilities.